Insulin therapy indications. Guys, of course, all the type 1 diabetes mellitus patients will need insulin therapy. Keep in mind that these patients are usually lean and young. You know that majority of the type 1 diabetes mellitus patients will be identified or diagnosed before puberty. Other patients are usually diagnosed by the 30th year of age or before the 30th year of age. So these patients will have to go on insulin. Type 2 diabetes mellitus patients, it is a little bit more tricky to figure out when to start them on insulin. Many times, patient and doctor both are fearful to start on the insulin therapy because of the fear of the pinpricks and glucose tests and so on. Also, sometimes patients actually take this as their failure and they are hesitant to start saying, hey, why not I try to improve my diet or exercise and so on. Just reassure them that type 2 diabetes mellitus is insulin resistance plus the beta cells start burning out, and sometimes you reach a point where there is sufficient quantity of the beta cells lost that the remaining cells just cannot make enough insulin to meet the body's needs. So they will have to go on the insulin therapy. Normally 10 to 15 years after the onset of type 2 diabetes mellitus, the patients will need to go on the insulin. However, there is a general criteria that you as a practitioner, as a doctor should know, and that is that when one of the drugs, the first line drug is metformin, when that drug fails, you have a choice to make to either start another oral drug or to start with the insulin. Normally, we start another oral drug or even a third oral drug. However, if hemoglobin A1C levels are greater than 8.5%, then consider starting on insulin instead of another oral agent. So here are some of the guidelines to start thinking about insulin therapy. When hemoglobin A1C levels are greater than 9.5%, that is for sure start on insulin. If you do a fasting glucose level for a patient and the levels are greater than 250 milligram per deciliter, start on insulin or consider starting on insulin. Random glucose, if that is greater than 300 milligram per deciliter, start on insulin. Ketonuria is present. Unplanned weight loss is present in association with hyperglycemia. Or if the patient is actually not known to be of type 1 or type 2 diabetes mellitus, but the patient has come to you with hyperglycemia or with ketosis. So such patients will need to start on insulin as well.
Guys, thank you very much for watching. Make sure that you like, subscribe, and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly. So if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.